Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we help long-term ventilated adults and children with tracheostomy to improve their quality of life, and where we also help hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I was talking about the 5 things you didn't know intensive care at home can do for your ICU. If you want to read the article, you can click on this link below the video. In this week's blog, I want to ask the question: has intensive care become obsolete for long-term ventilated adults and children with tracheostomy? Having worked in intensive care for nearly 15 years now has given me a very different perspective about life, about life's limitations, and also about life's possibilities, irrespective of the challenges that some people encounter within intensive care. And I guess everybody who has worked in intensive care for any period of time would agree that working in intensive care is not necessarily for normal people. A few of those years that I worked in intensive care, I also worked in the community with long-term ventilated adults and children with tracheostomy, and I looked after them in their own home. The alternative for those long-term ventilated adults and children with tracheostomy and their families was a long-term stay in intensive care. Thankfully, in most European countries, mainly in Germany, Austria and Switzerland, the alternative to a long-term stay in intensive care for long-term ventilated adults and children with tracheostomy is home care, based on successful models of intensive home care nursing that provide a genuine alternative to a long-term stay in intensive care. More importantly, intensive care and the burdensome, lengthy stay for those long-term ventilated adults and children with tracheostomy has in reality become obsolete. And it's a no-brainer for everybody who has seen it or worked in a home care environment with long-term ventilated adults and children with tracheostomy. It's a no-brainer for patients, their families. It's a no-brainer for intensive care units, for doctors, for nurses, and for health funds, whether they are public or private. Because it works, and it has been proven over and over again. And why, do you wonder, has it been so successful? Because everybody who has dealt with or looked after depressed, long-term ventilated adults and children with tracheostomy in intensive care knows that such a limiting and inhibiting environment that is intensive care cannot provide the quality of life or the quality of end of life for long-term ventilated adults and children with tracheostomy. Therefore, intensive care has become obsolete for long-term ventilated adults and children with tracheostomy, and everybody who has worked with long-term ventilated adults and children with tracheostomy in their own home knows that the improved quality of life for those clients and their family is something that enables them to blossom in their own environment, gives them more control over their destiny with the right support structure. It enables them to look at possibilities and opportunities, for example, go back to work, go to kindergarten, to school, university, you name it. And they can be around their family and their loved ones. And their loved ones don't have to travel to hospital every single day. What are your thoughts? Do you think that intensive care has become obsolete for long-term ventilated adults and children with tracheostomy? Leave your comments on the blog. If you want to discuss your needs and how we can help your intensive care unit and your long-term ventilated patients and their families, and if your organization wants to free up some ICU beds, or if you simply have any questions, give me a call on 041 094 2230, or simply send me an email to patrick@intensivecareathome.com.au. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.